Well, now is the time that we actually announce the winner of the Value-Based Healthcare Prize of the Netherlands in this year, the prize 2020. Before we actually give the nominee, the winner's name, I just want to share some of the overall lessons that were learned in this process of going through this prize this year, and some of the things that we have gained in going forward. So first of all, this is always an inspiring event. When you hear those 13 nominees covering all those critical fields, you have real confidence that things are changing, that we're not just stuck, we're just not following the same old paradigm, we're actually doing things differently. And we're thinking in value terms, and we're thinking rigorously, we're applying data, we're measuring all the things that healthcare historically has not had in the amount and intensity that has been needed. So in terms of the challenges right now that we have been learning about as we've been going through this process and working around the world is the very critical importance of COVID. COVID has had a major impact on healthcare delivery, and obviously it creates enormous challenges for healthcare, given patients, given a complex disease, lots of uncertainty about how to care, a lack of technologies in many cases that we are 100% sure exactly how to use and how well they work. What's happening though is COVID is actually accelerating value-based healthcare adoption, and especially in really focusing on outcomes. How are we doing? What are we delivering? Teamwork. COVID, when it first started, those patients tend to be all around the hospitals. They'd go in the emergency room, and then they'd go somewhere else, and then they'd be in respiratory care. And we had sort of a jumble of care delivery. But COVID is now really forcing people to look at that patient group and being able to integrate care for them across their whole care cycle. And that is a very exciting development. And we are very excited about that here in the US because we're having the same effect. There's also been an acceleration, partly due to COVID, of health IT, rolling it out throughout the care process and really enabling better communication, both with the physicians, among the physicians, but also with the patient. The digital is finally coming of age in healthcare. It's finally getting powerful. There's more work to be done, but I think COVID has actually been an accelerator of the digital adoption in healthcare. I would also say that the pandemic has highlighted the critically important need to understand cost. As all of us know, cost has been extremely costly to deal with this problem all over the world. And that's because it involves a complex disease with multiple dimensions that takes time, that have patients with very different circumstances, very different degrees of seriousness, different co-occurring conditions. And in order to do this well, in order to be able to afford it, there's been a lot of effort to understand the cost. And how do we look at the cost of delivering care for this disease? How do we also learn to pay for it, not in a bunch of fragmented payments to different parts of the healthcare organization, but really in bundles. And bundles is where we pay basically a single overall price to cover the full care for a medical problem. And that often has many dimensions. And COVID is a very good example of that. What bundle payment does is it's value-based reimbursement. It's reimbursement for the value you create by dealing with the whole problem, rather than paying people for individual services along the way. And one of the biggest challenges we have in healthcare is to go from reimbursement based on volume. Did you do a surgery or did you provide a blood test? But payment based on value. What was the overall effect that you created through the set of interventions that were involved in caring for a particular patient group? So again, the pandemic has started to help us make that tremendous jump in reimbursement. I personally feel that getting the reimbursement right, getting it aligned with value, rewarding integration, rewarding integrated care, paying for good outcomes, this is the Holy Grail. This is what's going to, at the end of the day, really transform healthcare forever. And if we can make that move, which is hard to do because we have so many years of experience with reimbursement systems that really don't make any sense from a healthcare value point of view, if we can make that transition, we're going to be very, very excited about what can happen. So with that context, I'd like to just now take the opportunity and have the honor of announcing the Value-Based Healthcare Prize winner in the Netherlands in 2020. Let me also congratulate the winners of the Excellence Awards, who are also doing fine work, and we'll be able to see and hear about them a little bit later. Those of you that are Excellence Awards winners, I would encourage you, don't stop. Keep working, continue your effort, and hopefully next year you'll be a winner, the winner, and or at least one of the nominees. So this work is takes a long time to do it. It's the more you do it, the better you get. One of the things we learn about healthcare, as we learned in many other fields, is experience matters. If we do more of something and we do it in a consistent way, and if we're disciplined about doing it, we get better a lot faster than if we do one thing this day, and then 2 weeks from now we do that again, and then 3 weeks from now we do that again. What we're learning in healthcare is that has afflicted us. That has cost us not only cost, but it's also cost us outcomes. So now it's finally time to announce this year's winner. It's hard to fully appreciate just how innovative these winners over the years of this program have been. This year, the winner of the Value-Based Healthcare Prize 2020 is Santeon, Together Better Program. All I can say is they're working on something really important, as I described earlier, and congratulations on this remarkable ability to demonstrate value and innovate. And hopefully Santeon can be proud of themselves for what they've done. Santeon's long been involved in value-based healthcare. They're just now continuing and getting better. And I really want to congratulate the whole organization for its philosophy, for its values, and also the team that led this effort for this remarkable success. So Santeon Value-Based Healthcare Prize for 2020. Congratulations and bravo, as we say in America. Let's give them a round of applause. They deserve it. This is wonderful work.